My name is Giancarlo Villabanes and my partner is Today, we are the reporter about integrated management of childhood illness for fever. So here are the topics outline of our report. First, fever overview. Second, fever definition. Third, fever causes. Fourth, how to measure the child temperature. Fifth, should I treat the child fever? Sixth, fever treatment options. Seventh, Imci of fever. So first, let's start the fever overview. Fever is a normal response to a variety of conditions, the most common of which is infection. Fever occurs when the body's temperature is elevated as a result of a body's thermostat being reset to a higher than usual temperature. Nearly every child will develop a fever at some point. The challenge for parents is to know when to be concerned. This topic will discuss the definition of fever, how to accurately measure the child's temperature, how and when to treat fever, and signs and symptoms that require further evaluation. So balikan natin tong salitang thermostat. So itong thermostat na to, ito ay makikita sa parte ng ating utak na tinatawag na hypothalamus. So itong hypothalamus na to, ito yung nakakaalam ng temperatura ng isang bata na dapat ay around 98.6 Fahrenheit or 37 Celsius. And ito ay nag-send ng mensahe to the body to keep it that way. So for our fourth slide, which is the fever definition. So because of the normal variation in the body temperature, there is no single value that is defined as fever. In general, a fever means temperature 100.4 Fahrenheit or 38 Celsius. You might get slightly different numbers depending on how you take your child temperature. Oral is for mouth, auxiliary is for armpit, ear, forehead, or rectal. So sa aking pagkakaalam po, ang auxiliary ear at forehead daw na temperature measurements, ito yung easier to obtain the rectal or oral temperature. But ito ay less accurate and may need to confirm rectally or orally in a certain children. So for our fifth slide, the fever causes. So infection is the most common cause of the fever in children. Common viral and bacterial illnesses are most likely illnesses to cause fever. These include, first is cold, second gastroenteritis, third ear infection, fourth croup, fifth bronchitis, sixth urinary tract infection or UTI. So first, ano nga ba tong cold? So ito yung most common illnesses na nagko-cause by the number of different viruses, more than 100 varieties of rhinovirus. So itong rhinovirus, it is responsible for the greatest number of colds. So meron pa pong ibang viruses na natawag na enteroviruses, ecoviruses, and coxsackie viruses. And also, this pandemic is the coronaviruses. Second is gastroenteritis. So ano nga po ba itong gastroenteritis na to? So ito po ay inflammation of the lining of the intestine caused by the viruses, bacteria, or parasites. Ito po ay second common illness in the US and also cause often of the novovirus infection. Ito po ay nag-i-spread through contaminated food or water or by the contact with an infected person. Third is ear infection. So ito po ay tinatawag na acute otitis media. Otitis means ear, media means middle ear. Ito po ay most common na develop after the viral respiratory tract infection such as cold or the flu. Ito po ay nagkakos din ng swelling sa mucous membrane from the nose and throat, and the diminish from the normal host of defenses such as the clearance of bacteria from the nose and increasing amount of bacteria. Fourth is croup. So what it is? So it is a viral infection of parainfluenzae or influenzae. So ito po yung nag-leads ng swelling of the larynx, also called voice box, and trachea, also called wine pop. So it is a common symptoms of barking cough and hoarseness. Fifth is bronchiolitis. So it is a cause of respiratory syncytial viruses or RSV because in certain hemisphere, RSV outbreaks usually occur from the November to April with a peak in January or February. If the children are older than 2 years old, it is cannot develop bronchitis, but can be infected the respiratory syncytial virus or RSV. Lastly, for the cause of fever is urinary tract infection or UTI. It is a caused by E. coli bacteria. Ito ay nakikita sa stool. Ito ay nag-move from the anus to the urethra and into the bladder. Sometimes it up to the kidney. High risk in boys is younger than 1 years old, and for the girls is younger than 4 years old. How to measure the child temperature? So this is the glass versus digital thermometer. So digital thermometer are expensive, widely available, and most accurate way to measure the temperature. A variety of styles are available. So this digital thermometer, if not available, be carefully shake down the glass thermometer before use. While the glass is contained are not recommended. Bakit? Kasi nga, ito ay potential ito sa risk ng exposure. At isa pa, ito ay toxic if the thermometer is breakdown. So the other types of the thermometer is including plastic, stripe, and pacifier thermometer. Next, where to measure temperature. For children who can hold a thermometer under the tongue using proper technique, usually children older than 4 or 5 years, temperature can be measured accurately in the mouth. For infants and children who cannot hold a thermometer under the tongue, temperature can be measured in the armpit. If the armpit is temperature is over 99 Fahrenheit or 37.2 Celsius and there is concern that the child is ill, a rectal temperature may be necessary. According to the PowerPoint, so we can use the rectal temperature if the armpit temperature is over 99 Fahrenheit and 37.2 Celsius. So take note of that.
How to measure temperature at a specific site. So first you have rectal. While we doing rectal temperature, papahigaan natin yung baby and then we put a small amount of petroleum jelly dun sa thermometer para maging easily yung pag-insert nung thermometer dun sa rectal ng baby. And then, ang normal temperature ng rectal ng baby is 36.6 to 38 degrees Celsius.
So, second is oral temperature. So, make sure do not measure temperature in the child's mouth. If he or she has consumed a hot or cold food or drink in the last 30 minutes. Make sure clean the temperature with cold water and soap and rinse with water. Place the tip of thermometer under the child's tongue toward the back. Ask the child to hold the thermometer with his or her lips. Keep the child sealed around the thermometer. A glass thermometer requires approximately 3 minutes, while most digital thermometers need less than 1 minute. Third is armpit temperature. So place the tip of the thermometer in the child's dry armpit. So make sure dapat dry yung armpit ng isang bata para ma-accurate natin yung tama ng reading ng isang temperature niya. Para malaman natin kung moderate or severe ba yung fever niya. So next is hold the thermometer in place by holding the child's elbow against the chest for 4 to 5 minutes.
Ear temperature. So ear thermometers are not accurately as rectal and oral thermometers. So basically, ang normal ng temperature ng baby sa ear is 35.8 to 38 degrees Celsius.
Lastly is temporal artery temperature. The temperature of the temporal artery can be taken by a device that is run over the forehead and in front of the ear contact, or one that takes the temperature without touching your child using the infrared sensor or non-contact. So this temporal artery temperature is this device are not accurate as a rectal or oral temperature, but may be used to screen for fever in children older than 4 years of age. So next is should treat the child fever. So this evaluation recommended is a healthcare provider should be consulted in the following situation. So this have 8 situations. First is infants who are less than 3 months of age who have a rectal temperature of 100.4 Fahrenheit, 38 Celsius or greater. Regardless of how infant appears, even when appearing young infants should not be evaluated. These patients should not receive fever medication acetaminophen until they have consulted with their healthcare provider. Second, Children who are 3 months or 3 years have a rectal temperature of 100.4 Fahrenheit, 38 Celsius or greater for more than 3 days, or who appear ill, fussy, clinky, refusing to drink fluids. Third is children who are 3 to 36 months who have a rectal temperature of 102 Fahrenheit, 38.9 Celsius or greater. Fourth is children or any age whose oral rectal tympanic membrane or forehead temperature is 104 Fahrenheit to 40 Celsius or greater, or whose auxiliary of temperature is 103 Fahrenheit, 39.4 Celsius or greater. Fifth is children of any age who have a febrile seizures or convulsions that occur when a child between 6 months and 6 years of age has a temperature greater than 100.4 38 Celsius. 6 is children of any age who have recurrent fevers for more than 7 days, even if the fevers last only a few hours. 7 is children who any age who have a fever and have a chronic medical problems such as heart disease, cancer, lupus, and sickle cell anemia. And lastly is children who have a fever as well as a new skin rash.
So, treatment recommended is para maiwasan or maagapan yung pwedeng malalang mangyari dun sa patient or dun sa baby na merong fever. And pwedeng mangyari is yung kagaya ng seizure. Kaya dapat maagapan siya na hindi na pumantong sa ganong sitwasyon. Next is treatment not required. So, in most cases, it is not necessary to treat child's fever. Lalo na kung, for example is, yung temperature ng rectal ng baby is 38.9 degrees Celsius, which is acting normally and otherwise healthy. So, hindi naman na kailangan na i-treat yun kasi normal naman. And para ma-ensure ng parents kung kailangan pa ba ng treatment dun sa fever ng kanilang baby is they can contact the healthcare provider. Treatment options, we have acetaminophen and ibuprofen. So these medications should only be given as needed. So hindi natin to kailangang ipainom kung hindi naman kinakailangan or kung wala naman lagnat yung patient.
So for the second fever treatment options is increased fluids. So having fever can increase child risk of becoming dehydrated. To reduce his risk, parents should encourage the child to drink an adequate amount of fluids. Children with fever may not feel hungry and it's necessary to force them to eat. So first is milk, cows or breast. Water should be offered frequently. For older children may eat flavored gelatin, soup, or frozen popsicles. Take note, if the child is unwilling to unable to drink fluids for more than few hours, the parent should consult child's care provider. And the third treatment options is rest. Having a fever causes most children to feel tired and anxious. During this time, parents should encourage their child to rest as much as child wants. It is not necessary to force the child to sleep or rest if he or she begins to feel better. So kapag ang children is return to school or other activities when the temperature has been normal for 24 hours. Lastly, sponging and baths. Sponging is not as an effective medication for fever and generally is not recommended. So if the alcohol should not be used for sponging because of the risk of toxicity, it is absorbed through the skin of the baby.
So here are the example of IMCI of fever. So first, we have color pink, which is urgent referral undergo to referral facility. So first, we have signs, any general danger sign and stiff neck. Next is classify as if it is very severe or febrile disease. Last is identify treatment. Give quinine for severe malaria at first dose. Give first dose of an appropriate antibiotic. Treat the child to prevent low blood sugar. Give 1 dose of paracetamol in clinic for high fever. For example, is 38.5 degrees Celsius and above. And the last is referral urgently to hospital.
In the yellow color, it is a treatment at outpatient health facility. So for signs is fever by history or feels hot or temperature 37.5 Celsius or above. It is classified as malaria, and identified treatment is if no cough with fast breathing threat with oral anti-malarial, or if cough with fast breathing threat with cotrimoxazole for 5 days, and give 1 dose of paracetamol in clinic for high fever 38.5 Celsius or above. Advise mother when to return immediately. Follow up in 2 days if fever is persist. If fever is present every day for more than 7 days, refer for assessment. So that's all.
Thank you for listening.